We are live online, getting ready to go live on 8:60 a.m. The Answer in the San Francisco Bay Area. Get ready, everybody. We have a great show ahead. Stand by. If you have any questions for us, go ahead and put them in comments across our streaming media, and we will get to them as soon as we can. You can also join the link that is in the description of the live stream we are doing right now, and you can participate and ask your questions yourself. Here
On
we
that
go,
note, we have
Colin.
about 10 seconds till we air.
Thank you, Colin.
Now, more than ever, you need information here when you need us. 8:60 a.m. The Answer. KTRB San Francisco. Streaming now on smart speakers and the Odyssey app service of Salem Media Group. This is 8:60 a.m. The Answer.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation. 60 minutes that can save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Abbott. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kym McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hi, everyone, and welcome to the show. This is the Heart of Innovation, and we are going to get to the heart of it very quickly because this is American Heart Month, and I want to bring to everybody's attention that 3 in 5 people who suffer a heart attack have blocked arteries in their legs. So your leg health could actually indicate your risk for a heart attack. And John, I think we should kick things off right away because we have a fantastic doctor, interventional cardiologist, Dr. Jason Yoho, out of Corpus Christi and San Antonio, Texas, along with one of his patients that is helped save, which is Douglas. So what do you think?
I agree. Let's roll because this is a fantastic month to highlight a disease that is the number one killer of Americans and those in the West. So let's hear the story.
I think we should invite in. Thank you so much, Dr. Yoho, for joining us. We really appreciate you.
It's my honor being here. I appreciate you having me on.
And we have Douglas. Douglas has been on quite a number of times. I think we've been on Douglas's journey for the past 2 years. He first started on this vascular and cardiovascular journey with symptoms in his legs. He ended up with what's called poor circulation or peripheral artery disease in his legs. And Douglas, how long did it take for doctors to finally realize that, there might be something going on with your heart as well? I imagine that they didn't check your heart right away when they found out you had blocked arteries in your legs.
No, they didn't. It was about 3 years before somebody started to ask questions. And then just within the last 6 months, I've gotten with Dr. Yoho. And within the last 6 months, we're on this journey together now.
Amen.
Wow. Now, Douglas, you've had bypass surgery, correct?
I had myectomy last September after I was diagnosed with atypical hydrochromia cardiomyopathy.
Yeah, atypical hypertrophic cardiomyopathy. And he's been through, 4 cardiothoracic surgeons since then? You've also had a defibrillator placed, right?
Yes.
And what symptoms were you experiencing that you went to all of these different doctors after that myectomy and no one listened until you went to Dr. Yoho?
There was a shortness of breath, a lot of chest pain. I couldn't sleep. Every time I laid down, it felt like somebody was sitting on my heart. And the pressure of my left side, just a lot of pain in there.
And yet no one seemed to do anything. What was going through your mind?
I just figured there was a point there. I figured I understood this is just what I'm going to have to live with.
And how did that make you feel?
There were days it was hard to keep that hope that this is, my life. I had to retire because of PAD. So now I have this going on with PAD at the same time. And it was like, what am I going to do? Driving. Am I going to drive? if I have an episode going to HEB, is that it? There were so many times I had an episode and I was thinking, well, this is it. I'll see y'all later.
And Dr. Yoho, what was, talk about your encounter and Douglas coming to you with all of these symptoms. What was your thought?
I mean, Douglas is a trooper. He's been through so much. So he had already been through the gamut of being through multiple doctors. And, it's very difficult if you put yourself in Douglas's position you start to get discouraged. You start to be disheartened that this is all they can do. I've heard from so many patients, and I get a lot of second opinions on complex patients like Douglas, where they're told, no, there's nothing else that can be done. When in reality, I think that doctors are like any other profession in that they can get, blinded sometimes and get their blinders on and miss the forest through the trees of, look, these are actual people like our family members, that quality of life is so extremely important. And if they don't have quality of life, well, maybe we're missing something. And so aside from Douglas's PAD, which, I'm sure you guys have talked about ad nauseum, here was a perfect textbook case of he's having cardiac symptoms. Where patients and doctors get blinded is when there's something else going on. Just a quick 30-second synopsis. What I know other cardiologists hear all the time is that I see, patients who have, say, COPD or breathing problems. It's so easy for other doctors to say, oh, that's just your lungs. It's just your lungs. It's just your lungs. And when in reality, they might have some blockages too. And they have COPD, but it's not as bad, not as debilitating as what it's been made out to be. And so here in Douglas's situation, he was diagnosed with apical hypertrophic cardiomyopathy. And so he went through the gamut with the myectomy and had a angiogram before all this. So basically it was, I think it's natural nature for a lot of people just to write it off. And I think the other thing to, if there's one great teaching point, about all of this is that what we do in our non-invasive tests have limits to them. And so, I'm sure Douglas has had many stress tests just like other people. Well, if the stress test doesn't match up with our symptoms, well, we have to look further. And I think a lot of doctors, and it's easy with today's day and age where we're being told to see more patients and patients are getting less time. And it's, to actually sit down and kind of look at it, because if you look at the statistics of what we do, a stress test, for instance, for the lay people out there, even a stress test, has only about an 85 to 90% sensitivity and specificity, which for realistic terms, what that means is what's the predictive value that's really accurate. And so what doctors forget sometimes is, okay, well, we got to take each patient into account. A patient who has no symptoms having the stress test is different than a patient who has really high early likelihood of having these. And so when you take somebody like Douglas, who has a high pretest probability, even if he has a normal stress test, that's only about 50% accurate when you look at the positive predictive value. Wow. So that's where you got to look further. And to me, treat everybody like you would your mom or your dad, and you make sure that things are good.
Coming up right here on the Heart of Innovation, we're going to hear a little bit more about the story, and we'll also get into the heart of what you should be asking your doctor to get diagnosed accurately. So stay with us.
Leg health can indicate risk for heart attack.
So I know you only have a couple minutes into the next break, but we'll get to you right away. Dr. Phillips, can you do your words of wisdom in the third? We'll start off the third segment with that.
100%. 100%.
But do you want to take us in and, really get to the heart of it really quickly with him, and
Sure.
Because I know that you were wanting to jump in and comment. And then Dr. Yoho, when you have to leave, just kind of wave, and
Okay.
we'll just say thank you, so much to you, and
No
we'll
worries.
just continue with the conversation.
I appreciate it.
But I'm going to tell you ahead of time, thank you so much for taking time last minute, and thank you for being
Anytime.
the one to listen.
You're the
Douglas.
man. You're
Anytime.
the man.
Hey, here's the thing, you weren't imagining things, bud. I mean, so ultimately the key is getting you feeling better.
Yeah.
Absolutely.
And that's where it'll be interesting because we probably want to get to exactly what you did, and what your thinking was. I just can't figure out how, I mean, he had multiple CTAs before. How was this missed? Or is it because they were cardiothoracic surgeons? Maybe they didn't have as much experience with general coronary arteries. I don't know.
Just give everyone a heads up. We have about 30 seconds till we air.
Okay, you can answer that with.
Looks like we're going to hear and then when we go live.
Yep, I'm going to let you take the reins, Dr. Phillips. All you.
Oh, Miss Kimberly, thank you.
All right, everybody, strap in. We got roughly 10 seconds till we air.
800 for relief. It all comes with the feel better or your money back guarantee. That number, 1-800, the number 4 relief. relieffactor.com.
This is 860 AM. The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody, and thank you for joining us. We are kicking off Heart Month, which is February, with a special guest and a gentleman that's been on our show quite many times, Douglas and his cardiologist, Dr. Yoho. So, Jason, tell me, you spoke of his diagnosis of apical or atypical hypertrophic cardiomyopathy. I guess if I was seeing Douglas, based on the fact that he had PAD, and you mentioned the stress test that was maybe read as normal, but I would have a really high suspicion that he had coronary disease. I'm assuming he's had heart catheterizations and ultimately some imaging that led to the diagnosis of the hypertrophic cardiomyopathy, basically a thickened heart muscle, which can cause symptoms of shortness of breath and chest discomfort in patients.
That's right. And the other big kicker, which we didn't mention before, is given that Douglas has a defibrillator, he was having a lot of PVCs and short runs of non-sustained ventricular tachycardia, right? So as you were saying, it's kind of like, for the lay people out there, a little bit of a puzzle, but when you start putting these pieces in place, okay, he's having irregular rhythms, which he wasn't having before. He's having more shortness of breath, which he wasn't having before. We know he has a history of this a severe PAD, which is a heart attack equivalent, let alone the fact that, he has had apical hypertrophic cardiomyopathy. He has these risk factors that could lead up to, a blockage, just like any of us. And kind of what I tell my patients, that irregardless of whether I have a stress test or I do walk on a treadmill today, I could walk down the street and something could change in my arteries tomorrow, right? Everything changes day by day. So I think the most important thing I did is I listened to my patient. And so, to me, something obviously changed in Douglas between the last 6 months that is worse. And so what I tell my patients is, okay, it may not be the heart. Let's cross our T's and dot our I's and make sure it's not. And then we can work our way back and figure it out. And hopefully it's something like blood pressure or sugars or something like that. But, to me, all of these red flags were standing up. We were talked about stress tests, and one of the things he had before was a CTA, which was supposedly read as normal. And kind of what I tell Douglas and I tell my patients is the test is only as good as what goes into it. And so in using it in the right patients, right? So every test has its limitations. And so using the right test and understanding that there's a degree of error in these tests. And so with CTAs, obviously calcifications is a degree of error. And Douglas has a ton of calcium. So, CTAs are limited by, even though it's a great technology, emerging technology that's coming along, they're limited by, our resolution, just like our TVs have different resolution. And so the heart's a moving object. And so it has a little difficulty sometimes differentiating between, say, a 70 or 80% and a 40%. And so if it's 100%, sure, it'll tell you. If it's normal, it'll tell you. But there's a lot of a gestalt to it.
So Jason, did he have, I guess, a couple of questions. He already has a defibrillator, so I have to assume that he either had a weakened heart muscle or, potentially lethal heart rhythms, number one. And then number two, was his diagnosis missed? Does he have coronary artery disease that was causing his symptoms, or is it the hypertrophic cardiomyopathy?
So his current so a lot of his workup was done well before me. So I saw him in the last 6 months. His previous symptoms, he had a lot of apical hypertrophic cardiomyopathy, and that was his symptoms. And his coronaries were essentially read as normal. Obviously, I didn't have the images to look at per se. But my understanding is they put the defibrillator in due to the hypertrophic cardiomyopathy or arrhythmias, and some non-sustained VT. However, he did have a decreased systolic function too. So, with no real reasoning for it. His LAD has mild disease. His circ is normal, but something didn't really add up there. Right. Something didn't add up. And so when I went in, the artery that goes to the backside, for everybody that's a layperson, his right coronary artery had a severe, probably 80-85% stenosis, that was severely calcified. And so some of the new great technologies we can use in the case, which allows you to essentially do a stress test on those vessels during the case, and take a camera to actually look inside.
Yeah. Did you use the intravascular ultrasound? There are some doctors that will say, that doesn't make a difference, but a 2D image versus, what IVUS can provide in a more of a 3D is remarkable.
It's a remarkable difference. And so, I can tell you my own father has heart disease, and that, some of his blockages were missed by just quickly looking at a 2D image. And so for those people out there, you have to remember that if what we're talking about is it's a moving and really undulating thing. And so if you're just looking at it in one direction, you could totally miss something that's on the other side of it. And so I pretty much consistently use IVUS in, say, 95% of my cases. And I'm a big believer in what's called FFR, fractional flow reserve, to really differentiate what is really causing the symptom. And so for everybody out there, what FFR is, and there's different variations now with different companies. The one we used for Douglas was called CathWorks, which is 3D angio FFR. And so basically if you put a kink in a hose, you can hear the water going through the hose because there's a change in pressure. And similarly, what this does is it evaluates the pressure before and after lesions. So we're able to tell if that's a significant lesion or not from how much of a difference in the pressure there is. So if there's at least a 20% difference, then we know that that's significant. And so when I did that for Douglas, his was somewhere around 40% difference, which is wildly abnormal. And so given that it was at the proximal or ostial, right coronary artery, that was affecting everything downstream, right? So for other people out there to think about, if you have a hose water in your backyard that's connected to other hoses water in your backyard, if you put a kink right at the spigot, it's going to affect the whole backyard. So he was having decreased flow throughout.
Wow, that's incredible. And so can you explain the right coronary? How does that correlate with breathing? Why did he have shortness of breath because of this?
Sure. So, the one of the tough things for patients, I think, is figuring out what symptoms are correlated with heart disease and what's correlated with, say, lung disease. And so, in fairness, what I tell my patients is that everybody's different. I have patients that never get typical chest pressure. And so, the whole backside of his heart was being fed by this artery. So when he was trying to use that muscle, right? So basically it's like if he's trying to lift a weight and he's getting no blood flow to his bicep, well, he's going to have trouble lifting that weight. Well, so if he was trying to exert himself and his muscle was getting tired really quick, which then led to him getting really short of breath as well.
So what are the next steps for Douglas?
So for everybody, I'm a huge advocate for cardiac rehab, and so to me, our heart's a muscle just like our legs and arms and everything else. We really need to get it back in shape. And so what we need to remember is, if I break my leg, well, my muscles get all weak, and we can see that. And we're used to saying, okay, I got to get my legs stronger. Well, we don't get to see the muscle in our heart. And so if we have a blockage in an artery of our heart, we got to remember, well, that muscle's taking it easy and it's getting weaker because it doesn't want to hurt itself. So we really need to strengthen that muscle like we would if we break our leg. And so cardiac rehab is, what I tell my patients, it's not much more than you can do on your own, but most of us don't do it. When it's a lot easier when you have somebody pushing you to work a little bit harder and you have an appointment to go to, and and somebody's paying attention and helping you get back into shape, as opposed to, okay, I'm going to get up and it's rainy on, Saturday morning. Am I going to really go walk? And so if you have an appointment, it's a lot easier for you to get back into that habit. Once you're back in the habit, yeah, we can all do it, but it's really getting back into that pattern of things.
Thank you so much, Dr. Yoho. I really appreciate it. Thank you for listening to Douglas and for being that advanced life and limb saver that we all appreciate. We appreciate you.
Thanks, Doug. It's my pleasure. I appreciate what y'all do, and y'all have a great day.
Thank you so much.
Thank
And coming up right
you.
here on the Heart of Innovation. Whoops, Douglas wants to say something really quick
Yes, sir.
before we go to break.
I really appreciate everything you went and above and beyond to help me get where I'm at today. I really do appreciate it.
My pleasure, Douglas. You're a good man. Keep it up.
Thank you,
Coming
Jason.
up, we'll
We'll
hear-
see you around.
Thank you. You guys have
We'll
a
hear
good one.
more from Douglas
Thanks.
and where he's at today and what's next for him. So stay with us right here on the Heart of Innovation.
3 years ago, my symptoms started with leg pain.
Y'all have some good timing.
Thank you. I'm curious who this. I'm wondering. There's a Sheila Freeman. Is that any of you? She has like 3 different things. Sheila, do you want to?
So, hang on, Kym. So, do you see Carla?
I see Carla.
Yeah, she has about 15 of her friends on her thing watching us right now from
On
her
3
heart group.
Oh,
That's awesome.
that's great. Thank you, Carla. I just think there's one person, Sheila, that has 3 different Zooms. Maybe she's using the same account on 3 different computers.
Definitely a possibility. Definitely so. I know that in this third segment coming up, we are going to do the. I don't know why I just blanked on this.
A moment of inspiration.
The moment of
John, do you want to
inspiration.
do a moment of inspiration here?
I'd love to.
Thank you. So, am I going to get the cue, or should I just wait until it ends? It ends. Let the music pod down, and then just fire it off.
Yeah. Why don't you just fire it off?
Copy that. Oh, by the way, right now we still should have about 2 minutes till we come back on air.
Oh, okay.
Cool.
So Carla, is that Sheila? Is Sheila as part of your group? I'm just wondering if she's struggling a little bit with getting on and getting audio, if we can help her somehow. Because she has 3 different things on, and one of them still says it's trying to connect to audio, so I'm not sure.
Maybe she could write it in the chat box.
Yeah, Carla, if you can write in the chat box, or Sheila, if you're having problems, let us help you. We're happy to help. I don't know.
Or maybe she's a spy.
Hey, play some 007 music. That'd be nice.
I can't even. I have Top Gun in my head, so I can't transition into the 007 music.
The government is watching all of you right now.
I always feel like somebody's watching me, and I have no privacy. Oh.
You know what? There was a part of me that thought maybe the show might be not boring, but a little bit tame. more tame than others, and I was wrong as usual. This is a good show, and it's going to be an even better show the second half.
Keith and me.
We'll have to talk about me flying solo without you, Kym, because I definitely missed your transitions.
Marcia said you did a
Hey,
brilliant
folks,
job.
sorry to interrupt. We got about 10 seconds till we come on air.
Marcia said you did a brilliant job.
Well,
you did, Dr.
Marcia,
Phillips. You did.
Or search Key Battles of American
Here we go.
History on your favorite podcast platform.
860 AM, The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips, spectacular vascular moment of inspiration.
Colin, well done. I think I was a little worried, like, how's that transition going to work? But
yeah, we need a little
fantastic.
celebration clapping for Colin and his
I know.
timing.
Wow!
Woo!
His transitions were certainly much better than mine when I was flying solo last week. But anyway, I digress. So what I wanted to do, I wanted a quote from a Dr. Helen Taussig, Taussig. She is roundly considered the first female cardiologist in the United States back in the kind of early-ish mid-1990s, or excuse me, 1900s. She was a pediatric cardiologist, and she really had significant contributions to the understanding what, quote, blue baby syndrome. And these are kids who were dying from cardiac arrest, and basically they did not have appropriate circulation. And so she was actually she was deaf in both ears as well. And because of that, her quote, the quote I'm going to use is, she stated as saying, quote, "We have to learn to listen with our fingers." And I found that quote pretty inspiring in the sense that it kind of opens you up to using your senses in different ways and not being limited by just kind of seeing things and hearing things and taking them for face value, but broadening out your kind of global scope for viewing the world. And I thought that was kind of interesting. So anyway, that's my quote of the day.
I think that's so perfect.
Listen with your fingers.
I think that's perfect. And I'm going to apply that very directly here for American Heart Month, because one of our acronyms that we use is CHAT, C-H-A-T, and it really encourages primary care physicians, cardiologists, whomever the doctor might be, to actually touch the patient. C stands for carotids. Make sure, check for a bruit, use your stethoscope, use your fingers. H is for heart. Make sure you're listening for AFib. Make sure you're listening for valvular issues, but you're touching the patient with your stethoscope. A is for abdomen. A is for checking for an aneurysm. Put that stethoscope on the abdomen. Put your fingers on the abdomen. Feel, listen for that bruit, that turbulent flow that could indicate that there's an aneurysm or some sort of turbulent flow happening in the abdomen. And of course, touch those DPs, touch those foot pulses. Have the patient take their socks off. Patients, you need to take your socks off at every appointment and say, "Hey, doc, not only look at my feet, but touch my feet," because they can, with one touch, they can detect whether there might be poor circulation, which could indicate, as we mentioned in the beginning, your leg health could indicate your risk for not only amputation, but also heart attack and stroke.
Can I
100%. Yeah, please, Douglas.
To that is the one thing I noticed about Dr. Yoho was, sorry about that. I knew it would happen.
I knew it would happen too.
I knew it would. I remember the first time I left his office, he did not once was he on the phone. Not once did he pick up the phone or do anything else. He actually it was an hour and 20 minutes in his office with him, and he answered he just went over everything. And that I noticed that was he didn't listen. Well, he listened to everything. And that was a big difference in how I felt about him and what he was doing.
Right. He took the notes, but he also took the time to take his head out of the computer and literally look at you, get up and actually touch you.
And I'll say that the greatest gift that this podcast has given to me, and I've said it before and I'll say it again, is the gift of empathy. And it's also caused me to use, again, the whole census thing to make me think a little bit differently about how the patient is perceiving the interaction that they're having with me. I mean, there's something called Press Ganey scores where the patient fills out basically a survey. And it's kind of like, have you ever been to a place where you're leaving and they're like, hey, here's a survey, make sure you give me a 5 on Yelp or whatever. And I mean, we kind of have things similar to that. And I don't really care too much about those, but I do care how the patient feels during the visit and after the visit. And I have learned so much from talking to folks on the calls here about how, they're people too, and they experience things and they hear things differently than the way I probably speak them. And so again, I think it's so important to, when you're talking to a patient, and I don't have an hour to spend with the patient. I just don't. And I'm oftentimes I'll try to schedule another one, or another visitor. We'll do a telehealth or something. But I think it's really important to capitalize on the amount of time that I have with the patient and make sure that I'm answering all their questions to the best of my ability.
Well,
Right,
Dr.
coming up
Phillips,
right here on the Heart of Innovation, we're going to hear more from Douglas, because I think that you hit such an important point, Dr. Phillips, where you have 15 minutes of experiencing what the patient is suffering, whereas the patient has to be living with what they're feeling and experiencing 24 hours a day. And that's tough to really come across
100%.
in just a few minutes. And so we're going to hear from Douglas about his experiences in those appointments with the other doctors prior to Dr. Yoho, and how he felt leaving that room without an answer. So stay with us. Medical Notepad, brought to you by Patient Advocacy.
Okay, everyone. So with the timing we've been doing right now, the next segment should actually be a full 10 minutes for us. So.
Okay, thank you. And Marie, that's a question for Dr. Phillips really quick. And I mean, I think any aneurysm is bad, but abdominal aneurysm versus a thoracic aneurysm, are they pretty equally dangerous, or is one more than the other?
Well, so a thoracic aneurysm, basically the way we describe them is the location of the aneurysm within the aorta. And so you've got the heart, and then there's the tube. The aorta is the big tube, and it kind of, quote, ascends, meaning it goes towards the head, and then it becomes the arch, and then it descends kind of down into near the belly button, and then branches off. And the thoracic portion is just kind of where it is on the body, in the thorax, above the diaphragm. So the abdominal aortic aneurysm, so kind of most of them are below the level of the kidneys. The biggest concern with those is rupture, and after they get to 5.5 centimeters, the rate of rupture is significant enough that it needs to be repaired. The ones in the thorax, the biggest concern with those is what's called a dissection, and so you get a tear within the artery. Has 3 layers that smush together like a sandwich, and you get, let's say you have a cheeseburger. Okay, you got your bun, your cheese, and the hamburger. And if you get a tear, a rip between the bun and the hamburger, blood is going to flow through that, and it's going to close off kind of the openings to the vessels that supply the spinal cord, the gut, the kidneys, things of that nature. So those are the 2 concerns we have. They're both equally dangerous. The more common one is the aortic aneurysm.
Is there like danger if you get hit in the stomach and you have an abdominal one?
So, the aorta is back up against the spine. I've never heard of anybody having trauma to the abdomen and it causing it to rupture. The problem with the aneurysm is that wall tension is directly correlated to diameter. So the bigger the diameter or radius, the higher the wall tension and the higher risk of rupture. And then it's also correlated to thickness. The thicker your hamburger and your cheese, your bun and your cheese, the thicker that is, the less likely it is going to rupture because there's less wall tension. So the thinner it is, the higher the wall tension. It's like a bike tire that's got a little bulge in it. But I mean, it's way in the back against the spine, so you'd have to have some serious trauma for it to rupture.
Hey everyone, with that, we are now going to be right at 10 seconds till we air.
Thank you taking us back and going right to Douglas?
You know it. You ready, Douglas?
Yes, sir.
This is SRN News. 8:60 a.m. The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody, and thank you for celebrating Heart Month with us, or at least kicking off Heart Month with us. That is February. And we're continuing our conversation with Douglas. It almost feels like a Save My Piggies, doesn't it, Douglas? Because you're telling us your story. And so we kind of left with your physician, Dr. Yoho. It sounds like he fixed your right coronary artery, probably put some stents in, I imagine. And you're feeling better?
Yeah, he ballooned it, and I have 2 stents in there now. And I think the biggest difference is from before to now. My brother I was at my brother's after I had the surgery. My brother tried to wake me up that morning, and he said, I have never in my life seen you sleeping like you were sleeping. So I think that goes back to that hope part. So after I saw him the first time, it takes 4 hours to drive home from his office to where I'm at. And this is what you and I were talking about a minute ago, is I drove home with hope. I actually had that hope, and Kym was talking about that. I remember I saw my first heart doctor on the 25th floor, and Kym remembers this. I remember walking out of his office and thinking, well, I just need to jump because it's over with. Because it was basically just, you're done, dude. Sorry, nothing we can do for you.
Douglas, can I just interrupt you for a second there? To the best of your ability, can you tell me what did they say to you that you interpreted that comment as, my life's over, or there's no help for me?
That appointment with him, he walked in, he was already on his phone. He said, I looked at what the test showed, and there's nothing we can do for you. And it was just really strange. And so I said, well, what do we do from here? And he said, well, there's really nothing I can do for you. So go home, take care of yourself. And that was the appointment.
I'm just shaking really my head, Kym.
I know. And it's really sad. And I've been through a few of them. There was one situation with Douglas where he called me. He said, Kym, I pulled into a gas station and I honestly can't make it home right now. Can you help me, get a hold of my brother? I'm calling 911. And the ambulance came and picked him up from the gas station, brought him to the hospital, and he was in the hospital for 4 to 5 days, had every test in the world, had every doctor in the world and their fellow coming in and assessing him, looking at him, talking to him. And they basically said, well, we can give you a pill for your myectomy that I think would slow down your heart rate a little bit. It's more experimental, but we're not allowed to give it to you in the hospital. So basically it was a waste of time for you to come in here, and you have to go home and go pick it up at your pharmacy. But they didn't bother at that point to do any further testing. I mean, the fact that there was an 85% blockage in his right coronary that they completely dismissed or didn't even bother to go in. And as Dr. Yoho said, he went in with advanced imaging. He went in the wrist in an actual angiogram, and he said, you know what? The symptoms don't make sense. Something is going on. Let me at least give him the benefit of the doubt, and I'm going to go in a very different way, and I am going to look for myself. I am not going to depend on some scan. I'm going to go in with intravascular ultrasound and the FFR, and I am going to literally get to the bottom of this. And he did.
Well, yeah, and it just speaks to the point that he made earlier that each patient, and it sounds like Captain Obvious here, but each patient is different. And I always tell patients, I'm like, well, not everybody reads our textbook, meaning not everybody's going to come to us and say, I have classic symptoms of claudication. In fact, women typically have atypical symptoms of claudication, as women have atypical symptoms for coronary artery disease. But it's kind of a Captain Obvious when you've got Douglas, who has severe peripheral arterial disease. And the overlap between peripheral arterial disease and coronary artery disease is very high. You had mentioned it. It's, anywhere of 20, 30, 40%. And so you kind of have to ask yourself, if he's coming to me with symptoms of shortness of breath, did I do everything I could to evaluate those symptoms? And maybe we got a stress test, and maybe it was read to be okay, but they're not right all the time. Sometimes they get it wrong. And it's just important we've said this before, you have to listen to the patient. They will tell you what's wrong with them if you listen to them long enough.
It's interesting because I just wonder in how many cases in your experience that the right coronary symptoms of a narrowing are brushed off as something else. Because my dad, more than a year ago, after he fell, he broke his hip, broke his arm, was in a wheelchair for 2 months. He got back on his feet, started walking. Within a month of walking, suddenly he started having shortness of breath. His smartwatch registered that his VO2 levels were low. He goes to the doctors, leads the witness, and says, my VO2 levels are low. I need that test. They put him in for that test. The test said he was normal. So they said, there's nothing wrong with your lungs. You're just out of shape. Now, fast forward a year later, he could barely make it up 3 stairs. And he calls me just before Christmas and says, Kym, I had to take the elevator. What's going on? I couldn't get through his regular doctor. I called Dr. James Joy, who's part of our network for the Way to My Heart, our organization. And I said, you save all my other patients. What should I do about my dad? He said, if you're willing to drive this far, I will get him in tomorrow morning. He had a severe blockage in 2 branches of the right coronary above 95%. The shortness of breath was a signal that something was going on. Now, mind you, with so many patients that have vascular or cardiovascular issues, there's a lot going on. There's a lot. I feel bad for all of you because it's a lot to sort out. And it's so easy to miss something because we were then blinded by the fact that he had bilateral acute clot in both of his common femoral veins, which then led to a couple chronic clots distally in his lungs. And so it was just like chiseling at a lot of things that were happening with him. But that's the same thing with Douglas. Because of his apical hypertrophic cardiomyopathy, they literally couldn't look past that to think that there might be something else going on.
Well, I mean, if I was seeing Douglas and we made the diagnosis of apical hypertrophic cardiomyopathy, which we never really kind of got into that, but it's an abnormal thickening of the heart muscle. And in fact, hypertrophic cardiomyopathy, and when we talk about the apex, that's kind of the tip of the heart. It's underneath the left breast. So the base of the heart is more up towards the clavicle. Typically, the whole heart is kind of thickened, and 1 in 500 people have hypertrophic cardiomyopathy, and it's actually the most common congenital defect that causes sudden cardiac death in athletes. You'll see somebody just collapse, and it's often hypertrophic cardiomyopathy. But having said that, you make that diagnosis, I'm assuming he would have had a heart catheterization in order to, if they're going to move to surgically remove some tissue and try to help the symptoms, you have to have a heart catheterization, because if they're going to go in to do that and there's some blockages, they probably would have done some bypasses too. So maybe he had blockages that developed since, well, Douglas, you can tell me, that developed since the surgery.
So how I was diagnosed with that, I saw a different doctor in Houston, and he diagnosed me with it. And within 2 months, I already had my myectomy. They came in. I was seeing Dr. Z in Houston for my right leg. Had a little problem on the table. They brought me to the hospital. That's when the doctor walked in. Within 10 minutes, he was going to put the defibrillator in. Then I saw the next doctor over there at that hospital, and he said, "You have atypical. We're going to do a myectomy tomorrow." And it was just like that. And it was like, I remember laying on that hospital bed in the emergency room, and the guy goes, "We're going to put a defibrillator in." And it was like, wait a minute, hold on, time out. What is going on here? I went in to have a stent done with Dr. Z in my leg, and now an hour and a half later, I'm in the ER, and you're going to put a defibrillator in. It's like, wait a minute, hold on.
Wow.
Well, coming up right here on the Heart of Innovation, we're going to have final thoughts from Douglas and some key takeaways you don't want to miss from Dr. Phillips. So stay with us.
Introducing the Pick a Term.
Don't you love that I just put you on the spot?
I do. I hope you're going to ask me a question that I can answer.
Well, the key takeaways, especially since it being, Heart Month, the key takeaways for patients that, because I was wondering, is there an easy test? I mean, they always wait for angina. The number one question they keep asking my dad is, do you have, chest pain? And then his regular cardiologist said, well, you usually, when you have a heart issue, usually you feel indigestion. Do you feel indigestion? And they brushed off the right coronary because he didn't have his typical indigestion. And so that's when I was like, I need to go to yet another one.
Well, right.
Sorry to interrupt. 10 seconds till we air.
Ah, shit. Okay.
To know more, visit hagar.group. That's HAGAR.group.
You said a dirty word.
60 a.m. The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. I want to get to Douglas really quick. Douglas, after you had that right coronary cleaned out, how are you feeling? Any better since then?
Oh, absolutely. I've been able to tell the difference in my sleeping. I still have some issues that we're talking about, but I think that goes back to what he said. I'm going to have to do some exercising and change some of that behavior, a little more change. And now I have the hope that they can go in and fix my blockages that I have in my legs now and finish doing what we started 3 years ago.
You look so much better. And your brother says he's seen you sleep deeper than he has seen you in years. So that's a good sign.
Yes.
Any key takeaways from you? Any advice based on your experience for those that are listening? And then also, Dr. Phillips, I wanted you to jump in afterwards with your final takeaways and lessons that others can learn from this experience as well.
Sure.
Douglas?
I think for me, the most important thing right now is the word hope. I remember and that hope of not having an episode and thinking this is it, and trying to have that hope every day of being positive and getting up and walking and doing and having a sustainable life, whatever that looked like, my woodworking and all of that. So I think the word hope now is really a big thing for me now is that I'm not having episodes all day long now. I don't really think about my defibrillator going off again. It went off 3 times in 10 minutes at one time. And it was like, it affected the thinking. So right now it is a positive. I got up and walked 2 miles this morning.
Wow.
So it took a little time because of my legs, but I still walked. And my eating, stopping smoking, doing all the stuff that I do now in the hope. And I'm not going to sit on the couch and let this disease take me. Nope, sorry. I'm going to I'm going to fight. I'm going to fight. I'm going to fight the whole way.
Good for you. Dr. Phillips?
Well, Kym, I love how formal you're being today. So, Ms. McNicholas, I will respond as such. Number one, I want people to have faith. I read a book that calls faith I think it's the eternal elixir that allows life, action, and power to be actualized through the impulse of thought. So faith is very important. You have to believe in yourself and believe that things can change, and you can change it. So number one, do what you can to prevent this disease. This disease is kind of preventable. So exercise. Make sure you get your cholesterol checked. Make sure you get your sugars under control. Don't smoke, okay? So do things that you can do and control what you can control, because there's a lot of stuff in life you can't control. And number two, you do the Way to My Heart. We do the Heart of Innovation, Save My Piggies, because it's patient advocacy. We want patients to be advocates for themselves. You know your body. If you're not hearing what you want to hear from your physician, or you don't think you're getting the right answers and you still think something's wrong, seek out somebody who can help you. And Kym, you do this every day, and we're thankful for you, but listen to your body. Don't take no for an answer.
Yeah, and if you do need help, you need someone to be by your side to fight for you, definitely call the Leg Saver hotline if you're here in the US. That is 415-320-7138, 415-320-7138, or go to padhelp.org or thewaytomyheart.org, and you can message us right through the website, and we will be by your side every step of the way, whether it's your vascular journey or cardiovascular journey. Thank you so much, everyone, for tuning in. We really appreciate you.
I'm playing it out, but you guys are clear.
I had no idea. I kept calling you Dr. Phillips
With Emmy Award-winning
until you said that. I didn't even realize. That is really funny.
I
had no idea. I started that back up again.
Our mission is to help patients
I want to share
life
something with Dr. Phillips
real
quick.
All right, I'm going to listen in. I'm going to come off.
Okay.
In partnership with the Way to My
I realize, I
Heart
think
and Abbott.
it may not have been an hour and a half, but it was longer than I had with any other doctor. And I think you said that word empathy. I felt like I was talking to my brother, or my brother listened to me. You know what I'm saying? Mm-hmm. So I understand why you said sometimes you don't have but 15, 20 minutes with a patient. But the phone, the computer, and that, maybe that can wait, so that when you're sitting across from me, I know that you're actually listening to me.
100%. 100%. I got to run, guys. We got basketball.
I do have good news, though, for you, Dr. Phillips, before we go,
yes, ma'am.
John.
Yes, ma'am.
And I want Charles to listen in. I am so excited, if everyone is listening, that we do have a major event coming up on the 17th for Black History Month and Pad Awareness Day. It's called PAD, the Lived African American Experience. And we ended up getting some major support from Phillips Healthcare with one of their amazing employees, who is going to be there during the entire event, and he is going to be whiteboarding all the key takeaways of the entire event, which is incredible.
That's awesome. That's awesome. I love Philip.
I'm really excited about that.